Hello and welcome to the Mental Health Agenda, a program designed to promote wellness by presenting topics and guests to increase mental health awareness in our community. I'm your host, Judy Gardner, Executive Director for NAMI Washtenaw County. Today our guest is Ashley Anderson. Ashley serves as the Community Outreach and Education Manager for the Corner Health Center in Ypsilanti. Ashley, welcome to our program.
Thank you for having me.
It's great to see you today and see you again. Ashley, can you tell me tell us and our viewers a little bit about the history and mission of Corner Health?
Yes. So Corner Health Center started in 1981, and we started in a small corner in Ypsilanti High School with the mission to address teen pregnancy rates in Washtenaw County. They were 6 times higher than the national average at the time, and so it was a really fortunate opportunity for us to be able to be located right inside the high school. And from that, we gained the name The Corner. Okay. Over the years, we've expanded and grown, and now you can find us on the corner of Huron and Michigan, right downtown Ypsi.
Wonderful.
So our mission is to inspire 12 through 25-year-olds to sustain healthy lives, and we do that by providing them with judgment-free, affordable health care services, wellness, and education. So we really want our mission to be simple but also impactful.
Okay. And does someone have to have insurance to come to your clinic? I mean, would they have to be covered by any type of insurance, or is it at no cost?
So we don't turn anyone away.
Okay.
So whether they have insurance, they're underinsured, or no insurance at all, we're not turning anyone away. So sometimes that looks like a sliding scale. Sometimes that looks like the services are covered. And if you have insurance, that's great for us.
Right. Absolutely. That makes sense. So Ashley, tell us a little more today about your role.
So I'm the Outreach and Education Manager. And my department oversees the social media, communications and marketing programs, some partnerships, anything really that touches people. We have something to do with it, and it's very fulfilling work.
Awesome, awesome. Tell us a little bit about some programs, specific programs or services that you offer. I know you've mentioned full healthcare spectrum, but what would that encompass? Is that mental health care as well?
Yes, so our comprehensive health care includes behavioral health services, clinic-based services, pregnancy care through our maternal infant health programs. So we see mothers before pregnancy, during, and after, and then we also take care of their children. And then we have gender-affirming care, as well as youth leadership programs, a free pantry and store for all of our patients and community members. We do support groups, we do programming, workshops, we're in schools. So we're doing, our services expand to really anything that will help us to help adolescents and young people be healthy, and it expands to where they are.
That is awesome. So how do you get your funding? I mean, do you seek donations or?
Yeah, so we have a variety of funding streams. A part of that, we are a clinic, so we do, receive clinic.
Yeah, I'm not going to ask you how you make your money, but.
Yeah, but we also do grants, and the grants are really helpful, and we have great donors as well.
Wonderful.
Yep.
So what do you see as one of the agency's goals for this year? Like most agencies have, you're doing great work. I know you're doing great work in the community. But is there a specific goal this year that you all have?
Yes. So our goal this year is twofold.
Okay.
On the one hand, we are really focusing on our internal measures. So this year we're doing a new strategic plan. We're looking at our assessments and seeing where can we afford to grow? Where do maybe we need help? Because, it would be remiss for us to be like, we're not healthy, but let's help make you healthy.
Absolutely.
So that's really important to our staff as well as our board. And then on the second measure for that is actually providing programming that is missing in Washtenaw County that our community is saying that's needed.
Okay, that is fantastic. Do you all do a community needs assessment to identify what the main needs are in the community? I know we're still in the midst though of a pandemic, and how has that changed? Just the pandemic. What are the things that you saw that changed during that rough last couple of years?
Right. So for community needs, the county does a community needs assessment,
Okay.
which we follow and we provide input for as well. But our patients tell us. And so, for example, right now we're working on a fatherhood initiative to build out programming for young fathers called Fathers for Family. It was after patients, parents, and even organizations that we partner with, they kept asking, do you have any programs for young dads? I have this young dad, he's stressed out.
Right. Okay.
I have this kid, he's in high school, he doesn't know what to do. And we had to keep saying, oh no, I'm sorry.
Yeah.
Oh no, it's only so many times,
Right.
you know, that you could say, oh no, I'm sorry, before you're like, this is a need. As well as with some of our transgender and non-binary patients, because we deal with adolescents, our primary focus is on them, and then, you know, anyone who has children. However, one of the things that we were hearing was that the parents, a lot of the adolescents who are identifying as transgender or non-binary, some of them are having really strained relationships with their families. And we looked and we couldn't find any programming that was in the form of a support group or education for the parents. And so that was another need that we recently just met. Doulas. You're talking about COVID. Before COVID, we had a growing doula program at Corner, and then, you know, COVID. Right. You know, it's like the answer to every question nowadays. We were, and then COVID, you know. So we are restarting that program.
Awesome.
We are excited, especially with, you know, Black Maternal Health Week coming up, to be able to say we have trained Black doulas on staff. We're looking to add more. We're really excited about that.
Sounds terrific. That is wonderful. So I've been hearing a little bit about this mental health workbook. Can you talk a little bit about the mental health workbook and how that's distributed and who can get that and what that's about?
Yes, I'm going to show it. Here's a copy for you.
Thank you very much.
So this is our mental health workbook that was created by our therapists, interns, community members, and then staff. And the mental health workbook is called Mind Over Matter, and it's really designed to be taken at your leisure. Through evidence-based practices, we decided to make a book where young people can look at their behaviors, or they can take a mental break, or they can assess some of their psychological needs without necessarily having to go straight to a therapist. And we received a grant to do it.
Awesome.
So that was really exciting, and the grant allowed us to give away 2,000 free copies.
Oh, wonderful.
Yes.
This is awesome. I can't wait to get to dive into this. This is great. And of course, you know, NAMI is all about mental health. So this really intersects very well with what you do. So we're happy to hear that. So last but not least, how does someone go about receiving your services? I mean, how do they, if they're interested in anything that you offer between those age groups, how do they call you up? Is there an intake process, or can you talk a little bit about that process?
Yes. So you can call 734-484-3600 and you can call and ask to be scheduled to see someone, or you can go on our website. You can schedule appointments there, or there's also other information. For our mental health services, we do require that you see a clinician first. So you will have to make a health appointment, and then they will assess and then get you scheduled with a therapist as soon as possible.
That sounds great. And any story, last question, that sticks out? It sounds like nothing but successes, right? But is there anything that sticks out for you since you've been a part of the Corner Health, a success story that you're really proud of?
Yeah, so this isn't my success story, but we actually have an office at Belleville High School. It's called E3, and through E3, we're able to offer therapy services to Belleville High School and the middle schoolers, whereas no therapist existed.
Wow.
In E3, our therapist there, she was able to work with a young patient who, after a few sessions, she identified was beginning to exhibit signs of bipolar schizophrenia
Okay.
disorder.
Yes.
And so after working with our therapist, she actually connected her to CMH and to a few other places so that she can get more help that she needed. And now this young lady is working.
Oh, wow,
She's
yes.
thriving. You know, there was a time where she was literally crying every day at school, not being able to focus, or just really wondering, like, what's wrong with me?
Right.
To go from that to thriving, to smiling, to connecting, because she was able to go to a therapist right at her school. And get the help that she needed. So we're really proud of being able to do that and being accessible.
Perfect answer, because that's exactly what I was looking for. Something great like that. And what a success story, and what wonderful work you do. So thank you so much, Ashley. Welcome back. We're talking with Ashley Anderson, Community Outreach and Education Manager for Corner Health Center. So Ashley, before the break, we were talking a little bit about the Mind Over Matter mental health workbook. This is a lovely workbook that you brought today. How can someone get one of those for themselves?
Yes, so you can come to Corner. We have physical copies available to give away. You can go to the website, www.cornerhealth.org/mindovermatter. There's a downloadable version, and if you have Kindle, you can download it for free.
Awesome. So there's all kinds of ways that you can obtain this great information.
Yes.
All right, so we're going to do a little bit of a focus on the mental health side of what Corner Health has to offer. So Ashley, can you tell me a little bit about what are the trends you're seeing with our youth around mental health?
So, you know, we grew up with the stigma of mental health. You know, you don't go to therapy. You know, what happens in this house stays in this house. And although a lot of mental health conversations are leading with that, like we know there's a stigma that exists, young people do not live with that same type of fear that we had of sharing. They are seeking services. They are signing up for therapists and to see someone and for support. But they're going through things, unfortunately, just like adults are going through. Yeah. That anxiety, depression, self-esteem. You know, a 12-year-old dealing with depression and anxiety, but it's happening. And so those trends are really what you would see anywhere, all across the nation. But we're doing what we can to make sure that we're available to them. And then, you know, it's kind of challenging when you look at the intersectionality of things. So if a young person is identifying as LGBTQ and maybe they're African American or Latinx, and then maybe they're identifying as female as well on top of economic situations. You know, they say we're in a recession. I don't know, but I know things are expensive.
Right.
So our young people, they're dealing with the impacts of all of that. And so we are seeing a trend of just high anxiety.
And it's so much. Also, how do you, because I know the family is a huge component in how we work together. I mean, we work together here at NAMI with educating families. Do you have anything at Corner Health that, and I think you spoke of that earlier in the program, of supporting families or educating families? Because I know that might be a big piece of it all also.
Yes. So Stand Out, which is our workshop for parents of transgender and non-binary youth, that is for the health of families, so that child and parent can have healthier conversations and the tools to talk about things that may be challenging or uncomfortable. Our Fathers for Family is about families. We know that the mental health and well-being of mother and child is directly linked to father and his mental health and his well-being and his ability to provide resources and be an ally to mother and child. That's about family. Of course, we take care of our patients and their children. We are focused on the family. Although it's 12 through 25, we want to offer services that impact the entire family.
Right. Because we really do have to work together, and you need the help of the families and the support, and to also educate caregivers and moms and dads and grandmothers. Because a lot of times, are you also finding that some of the youth that come to you are perhaps not even living with their parents? They might be with grandparents that are raising them.
Yes, yes.
Or other family members or older siblings.
Yes, some of these young people are on their own. Some of them are with friends. Some of them are with other family members. Our staff cares so much that not too long ago there was a patient, they had a birthday, and no one said happy birthday. No one gave them, anything. And they were really just down about it. Fortunately, we're right next to Go Ice Cream.
Oh, yeah.
And they gifted our staff with tokens, but our staff was like, no, go give it to this young person. Let's go get some ice cream. And we're consistently doing that because to be a productive, healthy, successful adult, we have to start taking care of the child. And, so many of us as adults, we're trying to work through and compensate for things that happen to us as kids.
Right.
And so we want to do the best that we can for these young people to know that you have support. We might not be blood. You might have to take a bus to get to us. But if you need support, if you need an ally, we want to be that.
That is beautiful for Corner Health to do that, because we need the entire community. You hear the old saying, it takes a village, and it truly does. We have to think about others. Well, we should. We don't have to. But we should think about others, because the community, anything that affects our youth is going to affect us all eventually, because they are the future. So I want to ask you something that everyone, I'm sure, has an opinion about right now, is what are your thoughts on mental health in our community? Just kind of elaborate on where you're at, just from Ashley Anderson's perspective.
Well, mental health, it's important, right? And I think we're at this place where it's kind of stuck between a hashtag, because saying I'm working on my mental health or mental health is important, that's the thing to do now. We're stuck between a hashtag and then the reality, which is the reality is at some point in our lives, we will struggle with some type of anxiety or some type of fear or some type of mental need. We titled the workbook Mind Over Matter to kind of reclaim the phrase. The phrase doesn't mean that if you just think your way out of it, you can be over your situation, but really the health of your mind affects the health of your entire body. It affects your experience in life. And so for me, I think the state of it or the climate is one that's growing, one where people are seeing the need, people in power, people with money, people with influence, they're understanding the need. And I'm hoping that we can all come together and find a way to where no young person has to go without mental health services, to where no young person has to go on a wait list, or no young person has to sign up for services and then can't receive those services till 3 or 4 months later. I believe there's a solution out there, and Corner, we're actually working to figure out how can we eliminate this time gap between when I need care and when I can get care.
Because we both know, and we know at NAMI, that early intervention does count. And so the earlier that you can address those mental health concerns, because all of us have mental health, right? I mean, we might not all have a diagnosis or live with a condition, but all of us have mental health that we need to be concerned about. So I am very pleased at what Corner Health is doing. It is wonderful to have met you today and everything that you bring. Is there any final thoughts that you might have, just that you want to tell our viewers today about Corner Health, or anything that you might want to share?
Yes. Our therapists are great, our staff is great, and it's because they are a support. If you're listening to this and you have a young person in your life that you can offer a listening ear, non-judgmental ear, please do that. Support is necessary. And if you don't have the resources, if you're struggling with transportation, if you have other needs, so we have a care manager. We take care of health, mind and body, but you know, we have a care manager who looks at things like your transportation, your housing, your job
wonderful.
security, your food security. So although we might not be able to provide it, we will definitely connect you to the person who can. And so I said a lot, but my final, you know, thought is just take care of yourself.
Yeah,
Take care of your mind so that your body can be taken care of.
absolutely.
And when you're struggling, don't be afraid to get help.
That is awesome. So we would like to thank Ashley Anderson for being our guest today. And we thank you for watching the Mental Health Agenda. I'm Judy Gardner, and we look forward to seeing you next time.